Thank you for joining our webinar, Back to School Preparation Strategies. I'm excited to introduce our presenter today, Michelle Griffiths. Michelle is a licensed clinical social worker from San Diego, California, who specializes in treating individuals with mood disorders, including depression, anxiety, and bipolar disorder. Michelle has worked in a variety of settings throughout her career in social work, from true nose to the grindstone social work to formal cognitive behavioral therapy in a hospital setting. Currently, she provides individual therapy to adolescents and adults in her private practice, Lucent Psychotherapy, as well as an intensive outpatient program providing group therapy to individuals with severe mood disorders. This back to school webinar will focus on preparing you and your loved ones for these challenges in both how to cope and plan ahead, as well as learning strategies to deal with difficulties we cannot plan for. The tools discussed here will be applicable to those with and even without bipolar disorder. Before we get started, I'd just like to remind you all that if there's time, we will be doing a Q&A at the end of the presentation. So if you're attending through Zoom, please type your questions into the Q&A chat box. And if you're joining us on Facebook Live, you can just leave a comment. Okay, thank you so much for joining us today, Michelle. You're welcome to get started whenever you're ready.
Awesome. Thanks, Natalie. Thank you guys for having me. Let me go ahead and share my presentation. 1 second. You know, I am not seeing, let me see if I can share. I'm not seeing my presentation now, Natalie.
Are you able to share your screen, or is the presentation just not popping up?
Yeah, it was before. Let me see if I can do.
Okay, it looks good. I can see it.
Okay. All right. Apologies. Okay. So we'll go ahead and get started. Again, this is a back to school webinar. We're going to talk about a lot of different things today. But to get started, I want to just kind of lay out the foundation of why are we even talking about this. It's been a very challenging year for everyone. And so I think going back to school this year is even more of an important topic than it has been in the past. So something I do want to just point out is that all of these skills, everything that's going to be brought up today, I want this to be applicable to whether you are a parent sending your kiddos back to school, whether you are a high school student going back to school, or someone starting a new school, or if you're going back to college. These skills can be applicable to really anyone. And we've known that they've been helpful to individuals with and without mental illness, including bipolar disorder. So the whole point here is that while we cannot prepare for everything that comes our way, we do know that it is helpful to at least plan ahead. When we're able to plan ahead, we can pinpoint certain challenges that we've experienced in the past and pinpoint certain coping strategies that we know have been helpful and could be helpful in the future. All while saying that regardless of how well you prepare, we also know that there are going to be ups and downs that we can't prepare for, and that is very normal. However, planning, thinking ahead, and having these tools ahead of time can help you to feel more confident in your ability to handle challenges. And when we feel confident in our abilities, we tend to function better. We can think more clearly, our problem-solving abilities are better, and so we typically are able to handle those challenges more easily. So again, this isn't just a blanket, like you're going to be able to solve everything. This is really to help you feel good going into situations that may come up, may not come up, and helping you feel confident throughout the school year. Now, because this is International Bipolar Foundation, I do have to just briefly touch on bipolar disorder. Some of you may have this diagnosis, some of you may have loved ones with the diagnosis. So I felt it important just to briefly touch on what is bipolar disorder. And there's a lot of information that I'm leaving out of this slide, but just to briefly explain, bipolar disorders 1 and 2 are characterized by highs and lows. Highs are mania, or for some people, hypomania, and the lows are typically depressive episodes, so episodes of depression. Each of these diagnoses, 1 or 2, can have different specifiers. And so your bipolar disorder is going to look a bit unique to you. And those specifiers can include things like psychosis, or if you're in a depressed episode currently, or if you have mixed type. The important thing, though, to keep in mind with bipolar disorder and really any mental illness is that they are all manageable. As long as you have the education, you're learning about it, you're asking questions. If you have treatment, whatever that looks like for you, for some people that's medication, for other people that is no medication, but other skills and coping strategies. And we always recommend therapy, just to have someone as an extra support and to bounce things off of. And the last piece to keeping bipolar disorder manageable is consistency. Consistency with taking care of yourself, managing medications if that's what you're using, consistency with treatment, all of those kinds of things. While knowing that you are human and you're going to have ups and downs naturally outside of any kind of disorder or mental illness. So, to really get started here, I want to give an agenda. This is a very general agenda, but we're going to go over 3 main areas today. The first is looking at something called early warning signs, vulnerability factors, and triggers, and I will get into what those are. The next piece here is going to be coping ahead. I know I've used the term coping already, so we will look specifically at what that means. And then lastly, we are looking at something called creating a buffer. So the last piece has a lot to do with preventative measures. These skills that I'm going to go over, a lot of you may have seen before. They are not necessarily rocket science, excuse me. But they are things that we forget and some things that you may not have heard of. So keeping an open mind that throwing as many skills at you as possible and having you build your toolbox and have that at the ready when you need it is going to be the most effective way for you to manage your well-being and your mental illness throughout the school year. All right. So let's get into what are early warning signs. You may have heard different terminology for these. Early warning signs are those symptoms that we experience that typically tip us off that we are either having a bipolar episode, or we're starting to go into a depression, or we're really starting to struggle more with our functioning and our well-being and our mental illness. Early warning signs can be really powerful when you're able to catch them. They give us good information. Now, with these warning signs, everyone's can look different. So I break them down into 4 different categories. The first being cognitive and the second being behavioral. So let me go over those. A cognitive warning sign. This is typically what's going on in your brain. So this can mean your thoughts usually. For example, if you start to notice when you get more depressed that your thoughts tend to fall into the more negative category, or you start to think more negatively about the world in general, your future, or even other people. That can be a really strong warning sign that you might be going into a depressive episode, or that you are really struggling with something going on at school or in your personal life. If we were to shift the focus specifically to bipolar disorder, a cognitive warning sign could look like this grandiosity, right? Where you're feeling suddenly like you could be queen or king of the world. Um, Not really talking about confidence. We want to see confidence. It's healthy, but this overly confident, which could lead to a manic episode or hypomania, could be a good sign that maybe you're on the verge of having a specific episode that's going to negatively impact you. So that's the cognitive piece. For other people, something that they might notice first could be behavioral warning signs. So maybe you don't notice what's going on in your body or in your brain, but maybe you notice that you are starting to withdraw from your social circle, or that you are being a bit more snappy at your support system, even when they haven't really done anything wrong. Or maybe if you're typically a social person, you start noticing that you are not returning those calls and texts that you typically would. Things start to feel a little bit more difficult. Things that you typically find easy or easier rather, you're having a harder time following through with. So again, you're going to notice different warning signs based on who you are. Okay. So then let's go to the other two categories here for warning signs. The next one is the emotional early warning signs. Now, maybe you miss the behavioral stuff. Maybe you don't really check out or notice what's going on in your thoughts or your cognitions, but maybe emotionally, this is where you start to feel and notice things first. Emotional warning signs are really noticing when you are having specific emotions more frequently and more intensely. So for example, if you are someone who starts to feel more guilty about things more frequently, and it's not really making sense, and maybe you can't really pinpoint what you've done wrong necessarily, that could be an early warning sign that maybe there's a depression coming on. If you notice that your anxiety is really heightened and you're having a really hard time settling your system or coming back down, that could also be a good warning sign. Along with that, some people notice that they feel more numb, right? So maybe they typically feel their feelings okay, but a warning sign for them is that they start to feel nothing. They feel like they're kind of shutting down or they're blocking things out. Could be a really powerful warning sign. And then lastly is the physical early warning signs. So emotions live within our bodies. And so sometimes the emotional warning signs and the physical warning signs can look very similar, but they are different. Physical warning signs are kind of like if I notice I'm just feeling a bit more achy, I've got more aches and pains more often than I typically do, and I know I'm not sick. Or maybe this means that I start to notice I've been clenching my jaw or grinding my teeth more frequently. And that's leading to like a migraine, right? Or frequent headaches. Those could be early warning signs that you are under stress and you either need to engage some of your tools or engage your support system. So early warning signs can be very, very powerful. They can tip us off, and then if we know what's happening and we have an idea of what's coming, then we have power to know what to do about it. If we miss everything completely, it's a lot harder to manage, okay? So these warning signs can actually help us feel more confident in the future, like dealing with future issues. Along with that, so warning signs are really the symptoms. I want to move next to something called vulnerability factors. We all have these, and these are really the things that we know about ourselves that typically make us more vulnerable to our triggers. And I'm going to go over triggers in just a second so that there's some context there. But it's really what leaves us a little bit more open or vulnerable to challenges, difficult things that come along, or even our intense emotions. Um, an example of a vulnerability factor could be, um, let's say you are going through loss, right? Or you're going through a divorce, and then you're starting the school year. Well, naturally, you're going to be more vulnerable to your feelings and to stress than if you were not going through loss or not going through the divorce, right? You've already got a lot of feelings going on. Um, you're trying to comprehend and process things. And so having an added stress is obviously going to make things more difficult. So it doesn't necessarily mean that we can get rid of our vulnerability factors, but it's good to be aware of them so that then you know what to do with them. Okay. A concrete example I like to give of vulnerability factors, and this is going to be applicable further down in the presentation as well, is if I'm someone who struggles with sleep, right? So sleep is very important to our well-being. It's kind of the thing that starts off every day, and it helps us go into the day and be able to function. So if I'm struggling with sleep and I'm having a hard time with sound sleep, well, maybe that means that I typically wake up a little bit later, right? Or um, there's one day during the week that I do wake up later. I miss my alarm. If I miss my alarm, then I might have a hard time finding time to get breakfast in. And so I haven't had any water. I haven't had my caffeine. I haven't had my breakfast, and I'm kind of rushing to class or work or whatever you're doing, right? If something happens, like I hit really bad traffic on the way in, or I get rear-ended in the parking lot at school, I'm naturally going to be more vulnerable to my feelings and to the stress of that situation that could happen than if I was able to sleep really well and I got up on time and I had my breakfast and I feel fueled and ready for the day. And I feel a little bit more calm because I am not in a rush. So it doesn't mean that we can always prevent things like that, like the sleep situation or rushing, but it's just to give you an idea that we are typically more vulnerable with certain things going on in our lives or certain things that have happened to us. So being aware of that can be very powerful for you. All right. Now, let's move on to triggers. I keep saying we are vulnerable to our triggers. A trigger, a lot of people have different terminology for this as well, but it's really just a situation, typically outside of our control, that we have a patterned reaction to. So the thing that we all have in common is that we will react to the same situation entirely differently based on our backgrounds, our beliefs, our values, our perspectives, everything that we've been taught growing up. So for example, if I'm walking to class, right, and someone walks by me and bumps me on the shoulder, well, maybe I have a thought like, how dare they? Or they need to watch out where they're going, or they did that on purpose. Whereas someone else might have a thought like, oh, they must not have been looking where they're going, right? And based on the way that we perceive that situation and event, that is going to lead to how we're feeling and typically how we're going to react. So in the first situation, if I'm thinking they did that on purpose, well, I might hold on to some anger, resentment. I might feel irritable. Maybe I'm a little bit shorter with my loved ones for the rest of the day, right? Versus the other situation, if I'm thinking, oh, they must have like not seen where they're going. Well, maybe I'm not going to hold on to that necessarily, and I'm going to be able to let it go and move forward with my day. So our triggers, again, they're unique to us. And just because I have a trigger that someone else doesn't mean there's anything wrong with me. It's based on our history and our experiences. Knowing what our triggers are could help us prepare to deal with them more effectively versus dealing with them in a way that's going to make our lives harder, right? So if I'm having a really hard time, let's say I feel or perceive that I'm being rejected by my classmates or my peers. Well, if I'm not aware of what's happening for me, that I'm feeling more sensitive and vulnerable because I perceive that I've been rejected by my peers, I may then pull away and isolate. And that's going to lead to a whole other host of issues, right? Versus if I'm aware, I can catch some of my thinking, check out if it's realistic, and then continue to engage with my peers and maybe show myself that it's not necessarily a rejection, that I'm doing a lot of mind reading. So triggers, again, just like the other things that we've discussed, very, very important, can be very powerful to give us control to know what to do with them and how to handle them. All right. So that leads us to, what do we do? We are going to talk about different coping strategies. And if I had it my way, I could probably talk for hours on the specific coping strategies. So unfortunately, I'm going to throw a lot at you with only sort of brief introductions to them and descriptions. However, the important thing here is creating a plan. So what we ideally would ask you to do, if it's helpful, if you think it's important, writing down those early warning signs, having them on a concrete piece of paper somewhere, right? Somewhere very accessible. With that, even writing down certain coping skills or strategies that you know have worked for you, or ones that you know you can try if those warning signs came up. The next piece, which is probably one of the most important, is being able to create a plan with your support network. Okay. And we're going to talk about, well, what if you're lacking a support network? But that's, I think, the next slide. So including your support network, your safe people who maybe are aware of some of the difficulties that you struggle with. And even if they're not aware, maybe bringing them in so that you can build your support network. The bigger your support network, I think, the better. We can't function necessarily in a vacuum. These things are difficult, and the more support we have, the more people that we have to lean on, the better, ideally. The next thing would be kind of along with that, the support network is including your providers. So if you have a psychiatrist, if you have a therapist, especially for bipolar disorder, and if you're one who struggles with, panic disorder, anxiety disorders, depression, having providers can be really powerful because you can discuss with them a specific plan. They have a lot of experience typically in helping people prepare for challenges that come up. So talking with and communicating with your providers can be really, really important. The last thing on here is about medication. Now, I have to give a disclaimer. I am not a medical doctor. I cannot recommend or give any kind of advice on medications. What I can say is what I've seen very effective in the past is discussing with your doctor, your psychiatrist, about a rescue medication for bipolar disorder. A rescue medication can be something that you take if you start to notice those early warning signs of mania, hypomania, or depression. And so that way you don't have to necessarily go straight to the ER. You don't have to necessarily go into the hospital, right? And you don't have to wait months to see your psychiatrist. So you're being proactive and you're discussing with your doctor, what do I do? If I have a manic or hypomanic episode, is there a medication I can double up on, right? Or increase, or is there one that I can have go to the ER and ask for, right? Those kinds of things. So again, this is planning ahead and it's being preventative. Which brings us to a little bit further down the support network. I know I've already discussed this, so I don't want to harp on this too much. But again, planning ahead, talking to your people about your warning signs can be really, really effective. And not only telling them and expressing to them what you know about yourself, but even asking them, if you're willing, what do they notice about you, right? If they've seen you in a manic or hypomanic episode before, or even a depression, what have they seen? What were some of the things, the changes that they saw leading up to that point, so that you guys can have a comprehensive idea of your early warning signs, okay? What's also really effective is, again, discussing a plan ahead of time. For some people, this can be a really sensitive topic. I don't necessarily want my parents coming to me and pointing out that I might be becoming hypomanic, right? It can be really frustrating. So having a plan ahead of time and discussing it, and even talking about ways to bring it up so that it doesn't come off as offensive or like they're being invasive, can be powerful. And it can not only help save your life, but it can keep you out of the hospital and keep you functioning in your school so that you can continue to work towards your goals, right? We don't want you to have to interrupt your schooling. That's really what this entire talk is all about. It can be really distressing when you have to take time away from school for your mental health. All right. Let's see. Oh, last thing I will just point out, if you are one who struggles with mental illness and you do not have providers, I highly recommend starting the search now. Going through your insurance can be effective, but it can take a while to get something scheduled. So start now, start as soon as possible. Leave as many voicemails as you feel you need to get that taken care of for you. Okay. Now, I wanted to touch on when we don't have a strong support network. Okay. Ideally, you do have providers, but keeping in mind that going into school is naturally going to be a bit uncomfortable, right? And in order to build a support network, it might take some time. You're not necessarily going to find close people that you can pull into your circle and talk about your warning signs with, right? But over time, ideally, you're going to be able to build those connections. And to start, you might have to get a little bit uncomfortable with joining groups at school, activities, even things that maybe you're not 100% interested in, maybe you're a little bit on the fence about, but putting yourself out there to, join in, right, to the school, build some sort of community, feel like you're connected. Being connected somewhere, especially in a school setting, can make a huge difference. When we feel like we belong and we're connected, we typically feel more confident. And when we feel more confident, we feel better, and we're typically able to function a little bit more easily. Okay. Some other things I added on here. Attend your office hours. If you're in college, you might find that there's a specific teacher or professor that you feel comfortable with. Just checking in with them. They're not a therapist, right? But at least you are kind of building that bridge and continuing to act opposite to any urge to isolate and withdraw. Okay. And then lastly, a lot of schools have some sort of counseling services. Now, they may be very, very limited, but I highly recommend, regardless of if you're in high school or your kiddos are in elementary school or you're in college, reaching out to see if there's a school social worker, if there's some sort of counseling, if there's even like support groups, right? There's a lot of support groups around town. I'm from San Diego, so we have a ton of support groups out here, but there may also be some groups at your schools as well. Can be a really good way to start to build connection. Okay, so next we are going to jump right into coping ahead. Now, the whole idea with a cope ahead plan, we are not trying here to catastrophize the worst case scenario necessarily, but there's a difference between worry and anxiety and being able to plan. Planning gives you some power and control over what's going to come. You can't plan for everything, we know that. but there are some things that you can plan for. So ideally, you're planning before the crisis. When you're in crisis, you have a harder time problem solving and thinking clearly. Typically, your fight or flight response is activated, right? And so we naturally do not problem solve very well. We don't think very clearly when we're in that situation. A cope ahead plan typically looks like imagining, thinking ahead of maybe an obstacle or a barrier that you could come across, excuse me, and thinking ahead of how you might be thinking, how you might be feeling, and how you might have the urge to react in that situation. So coping ahead pulls from sports psychology, actually, because in sports psychology, they typically do something where it's called in vivo. So they will imagine that they're doing something ahead of time. They'll like imagine that they're going through their course or, whatever sport it is, doing it really well over and over and over again. The more you're able to imagine yourself doing something well and dealing with it and handling it well, the more likely you are to actually be able to do it in person, in real life. So that's really what coping ahead looks like. If you have a cope ahead plan, talk to your support system, talk to your therapist about it. You can even come up with it with your support system, with your therapist, if appropriate. And the last piece on here I am going to talk about just very briefly. We're making a plan to increase our sense of control. Okay. Going into the school year, you might have a lot of anxiety, worry. You might even have some catastrophizing, worrying that you're going to fail out or you're going to become really overwhelmed and struggle to function. You're going to end up in the hospital, right? We all have different catastrophes that come up in our brains. Closing the gap is something where we're looking at what is anxiety and how do we tackle it. So anxiety really says that we are overestimating the amount of danger we'll be in, and we are overestimation, so my apology, that should be overestimation of danger. And the second piece is underestimating how much control we have in that situation, and we have to deal with the danger. And so coping ahead can help to define the danger. It can put some parameters on it. Anxiety can come about when the danger seems so big, we don't even really know what it is. It's kind of this big dark cloud hanging overhead. And so it's so big and so unknown that it's really hard to think about how to deal with it. So coping ahead can put some parameters on it. It can put some definition on it so we have a better idea of what we're dealing with. And then the other piece is listing those things, like we've already talked about, of what's in our control, right? If I have certain early warning signs, if I have certain triggers, what can I do about it? The more we feel like we have control in this situation, the lower our anxiety is. So essentially we start to close the gap on the danger and the control, if that makes sense. So coping ahead, very, very important. Okay. All right, I know I've thrown a lot at you guys already, but the next two slides can be really helpful. These are different skills to actually coping. Now, you may have a lot of your own that you find very helpful and effective. Please don't stop using those. This can also be really helpful to talk to your therapist about, or your providers about, or your family, right, support system. In order to survive a crisis, when we are in crisis, again, we are not thinking very clearly. We start to struggle with our ability to function and make sound and wise choices behaviorally. And so what can be helpful is distraction techniques. Really what we're doing is we are distracting our brain and our mind so that we stop feeding the emotion, okay? And so really what we're doing is changing the focus. Some of the ways that we can change the focus and distract, it's something called the ABC game, where we go through the alphabet, you pick a category, and from that category, you name something from that category with starting with each letter of the alphabet. For example, food, apple, banana, carrot, daikon, etc. The idea with the ABC game is not only are you naming different things, but you're ideally visualizing each of those items as well. It's really meant to slow your brain down and really focus on the task at hand. The next one here is called serial sevens. This is where we start from a certain number, 100, and we subtract by 7 until we can't go any further. So 100, 93, and that's typically as far as I get because I am not a mathematician. I'm a therapist. But serial sevens can be important, again, to distract your brain. You can go from 1,000,000, right? You can start from 1,000, whatever works for you. Another one can be putting on opposite music. And what I mean by that is if you're feeling really down, right? Well, maybe you need to put on some hyping music, right? Something to hype you up. You can also put on a comedy or a podcast that talks about something totally different than how you're feeling. We don't necessarily want to feed the sadness or feed what you're experiencing, okay? Another thing that can be helpful is changing your environment, getting out of the house. If you're on campus, right, going to find somewhere quiet, ideally, that you can just sit and take some deep breaths in. And then lastly, we have something called a self-soothe kit. This is something that you can keep at home. You could probably even bring it to class with you if needed. But really what you're doing is you're targeting your 5 senses. And so sight, taste, smell, touch, and hearing. Some people like to do, for example, essential oils in their kit. That's for smell, right? Or having a scenery picture on the background of their phone that's very soothing for them for sight. So really, whatever's going to help you in the moment to bring your focus back, right, to what's happening right here and now, ground you a little bit, and get you in touch with your 5 senses. All right. So those are some of the crisis survival techniques, especially when you are really in distress and you're at school or you've got a lot going on with your assignments, those kinds of things. These next ones can just be helpful in general. So checking the facts. We do a lot of mind reading. We jump to a lot of conclusions and we make a lot of assumptions. So checking the facts is really catching some of the thoughts that are coming up for you and checking out if they are a factual statement, if they're balanced, or they're really extreme. For example, if I get a B or a C on a test, right, I might have the thought, look at me, I'm already failing, right? I can't do anything right. Well, checking the facts can talk back to that a little bit. Is it true that I'm already failing? No, a B or a C is not failing, right? I can't do anything right is another thought. Well, that's not actually true, right? There's a lot of things that I have done right, and maybe I wanted to do better on this test. So checking the facts can actually reduce the intensity of how we're feeling in the moment. Stop is a skill where we essentially can picture a big red stop sign. If you find yourself ruminating or you got racing thoughts, right? Picturing a stop sign can kind of bring you back to the here and now. It can be a good reminder of, hold on, my mind is running away from me and I need to settle for a minute, right? Where am I? Using some grounding, bringing yourself back to the present moment. Mindfulness, another very powerful one, bringing awareness to the moment and detaching from some of those thoughts that really carry us away and contribute to us struggling in school. Maintaining structure. We're going to talk a bit about that below. And then something called opposite action. If you have the urge to withdraw and isolate, do something different. Reach out to the friend, even if it's really difficult. Okay. All right. I just put up some brief coping ahead examples. The example on the left, this can really be to survive a crisis. So looking at your warning signs, identifying coping strategies, including places that you can go to provide distraction, and then who can you reach out to. Having names and specific numbers can be really effective. The example on the left, this other cope ahead plan, is a little different. So you're essentially imagining situations that bring you distress. So I'll just point out one here. Feeling anxious walking into a classroom, right? Especially if it's your first time walking in, or maybe you're running a little bit late, so you know that eyes are on you. Identifying how you're going to be feeling in your body, what you might be thinking, and what you might have the urge to do. Maybe I have the urge to run out. So then identifying specific tools you can use to keep yourself in the moment and help you deal with it and get through the moment. Okay. All right. So that's all coping ahead. We've gone through goals, basically 1 and 2 for our agenda. The last one, this is called creating a buffer. What I mean by creating a buffer is essentially, we want to make sure that we are taking as best care of ourselves as possible to arm ourselves to go into the battle, right? The battle that is the school year. You've probably heard of this before, but when you don't take care of yourself, or you struggle to take care of yourself, you're going to have a harder time functioning, and you're going to be more vulnerable to maybe a lapse in your mental illness symptoms. So creating a buffer is essentially just taking good care of yourself. And I have a couple tools that I'm going to show you briefly that can be effective for keeping you on track for that. The first is called GRAPES. GRAPES is an acronym. It stands for gentle with self, relaxation, accomplishment, pleasure, exercise, and socialization. All of these are really important to maintaining your level of functioning. Okay. When people are able to maintain these things, they typically are able to stave off a depressive episode. Their anxiety can go down, and this could even be really helpful to managing certain bipolar symptoms. Okay. Gentle with self, treating yourself, talking to yourself how you treat a loved one. Relaxation is active relaxation, targeting the muscle tension that naturally comes with stress of the school year. Okay. Accomplishment, creating a to-do list, planning ahead, right? We've already talked about a lot of that stuff, but most importantly, giving yourself credit for what you're able to do versus beating yourself up for what you weren't able to do. The more you give yourself credit and feel good about what you did, the easier it will be to keep moving forward. Pleasure. We get really caught up in our to-do lists. We are a society that emphasizes accomplishment, right? The one just above it. Pleasure is really important as a protective factor, actually. We have to take those moments and build in positive experiences and be really intentional in that. Exercise doesn't mean going to the gym for 3 hours, right? This can really just mean moving your body. 20 to 30 minutes a day can be a powerful antidepressant. And I know I'm getting a little bit low on time here, so I might rush a little bit at the end here. Lastly, socialization. Connections with other humans are crucial to our survival as humans. Okay, so this is what the GRAPES planner could look like. You can always create this on your own. It's really just planning one thing you can do in each category ahead of time. Okay. And then the last main skill before I jump down into sleep hygiene is something called please. So this is kind of like GRAPES, except this really targets your like physical well-being. So treating physical illness means taking medications as prescribed, balanced eating, eating in a way that makes you feel good. So not any specific dietary recommendations here. Avoiding mood altering substances. So being mindful of how alcohol, marijuana, caffeine, nicotine, etc. impact your functioning and your mental health. Sleep, we're going to get into. Sleep is very important. And then lastly, exercise again. So I'm hoping I'll be able to leave these tools up on the site somewhere so that you guys have a better or some more time to review these if needed and access to them. And again, if you wanted a please planner, this could be an idea of what that could look like. You can definitely make this on your own as well. All right, I think this is the last slide. Sleep hygiene. Sleep is crucial, not only for individuals with bipolar disorder, but for anyone. We have to get good quality sleep. And if we're not sleeping, that could be a really important warning sign. So setting up a routine can be really powerful. Turning off electronics. We want to reduce the amount of stimulation. Using your bed only for sleep and rest, really, really important, and can be really hard, especially if you're away at college living in the dorms, but can be really powerful. And then the very last thing here I really want to emphasize, if you're someone who is struggling with sleep, there's some things you can do. Progressive muscle relaxation, which is, you can look that up on YouTube. Deep breathing, mindfulness, those kinds of things can help you fall asleep, but they can also help you if you're waking up in the middle of the night and struggling to fall back to sleep. But if you are not sleeping, not only do we need you to be reaching out to a provider as soon as possible, because that could be a sign that you're entering into an episode, but rest is important. So even if you're just laying in bed, resting your brain, resting your body, rest is still very important for your well-being. So I don't want you guys to necessarily catastrophize if there's a night where you're not able to sleep or you've only gotten a couple hours sleep. Rest is still very powerful. Okay. All right. I've added some crisis resources on here. I think there's quite a lot available on the internet as well, but really planning before the crisis is going to be most effective. And I know all of you will be able to handle this, especially if you have your support network and you are able to build some awareness of what happens for you and what you can use if needed. Okay. And lastly, just some credits. A lot of the skills here were taken from DBT, CBT, and MBSR. So if you have more questions on that, there's a ton of information. I'm sure there's some information on the IBPF website. If not, I'm happy to answer questions. And you can also do a lot of Googling. There's some good information and skills out there as well. All right.
Okay, thank you, Michelle, for that wonderful presentation. It looks like we have time for a Q&A, so if you didn't get a chance to send in your question, feel free to submit it now and we'll try to get to as many as we can. And I'm just going to jump into some of our questions. So for our first question, someone wanted to know, how do you cope with being unstable all the time? They said that they often find it hard to balance classes and schoolwork and their social life because they're rarely stable and they find it really discouraging.
Okay. Yeah, I would imagine that's very discouraging. It's a big one to answer. My recommendation is really just as much as you can involving your providers, asking a ton of questions, maybe even doubling up if you're seeing a therapist every so often, doubling up on sessions if possible, seeking a support group can be really powerful. And maybe being gentle on yourself of how many classes, right, are you are you looking at? Do you need to scale back a little bit so that you can have more of a balance and things can be a bit more achievable for you? So just because, maybe the expectation is five courses during a semester, maybe for you, we need to scale it back a little bit and just have a couple classes or one class at a time. That doesn't necessarily mean anything about you. It means that you're struggling, and it could be a better way or more effective way to take care of yourself.
Okay, awesome. Thank you. So for our next question, someone wanted to know if you have any tips for college students and how they can combat certain aspects of college life. For example, irregular sleep schedules, stress, homesickness, all of those things that tend to worsen mental health symptoms.
Yes. So again, this getting as regular of a sleep schedule as possible is going to be important. Um, Setting up a routine is going to be important, even if the timing of your sleep varies. Setting up a regular routine so that your brain and your body start to know, okay, it's time to shut down or power down. Homesickness, very normal. I would really recommend, if you can, reaching out to your support system, maybe even doing some journaling on what's coming up for you, and knowing that it's not going to be like that forever, right? And planning ahead for when's the next trip that I can see my people. If you have homesickness, that just tells me that you're very connected to your people back home and that you are in the process of adjusting to your new environment. And that's going to be difficult for everyone. So keeping in mind that most students do struggle with some sort of homesickness when they go away to college. And so if you feel like you're alone in that, you're definitely not. And I would recommend even joining some sort of club, groups. I don't know if you're into fraternities, sororities, so that you feel more connected and don't feel like you're the only one experiencing that. I hope that answers the question.
Yeah, great. Thank you for those tips. Those were all really awesome. So our next question is actually from a parent, and they wanted to know, should we inform my child's teachers about their bipolar diagnosis so they can receive accommodations? And if so, what's the best approach for how to do this?
I think that's going to be an individualized discussion to have. If your school or your kiddo's school has some sort of social worker or psychologist, I would actually recommend going through them first and maybe coming up with a plan. If you feel like you feel comfortable with the teacher and this is like a good support system and a safe person, absolutely going to the teacher, coming up with some sort of plan. But in order to have accommodations, you're probably going to need to go through the school psychologist if there is one, or the counselor or the school social worker. Those are really going to be the people that could help you with accommodations. It could even mean that you get going on an IEP, an individualized education plan, to help out with those accommodations. So it
Okay,
kind of
great.
depends. Kind of depends. Yeah.
Perfect. Okay. For our next question, someone wanted to know, what can you do to help someone who doesn't want to help themselves and they've completely stopped all contact with their mental health team? So, in other words, they're just comfortable with being sad and they don't want help.
Mhm. That's a really hard one. We cannot control what other people do or how they react. So I think it's important that your people or your person knows that you're there, but you can also set some healthy boundaries with them, for them and for yourself. So again, you can't control them. If they're not willing and they're not there yet to receive the help, you can't force it upon them. So maybe even taking a step back and doing your best to take care of yourself, right? Um, I even, I mean, I would love to have more information on that, but I wonder if there's even other people involved that maybe you're not aware of, or you could reach out to see if someone has eyes on this person. If you're concerned for safety, um, you could always do something called a welfare check. That's definitely last resort, but if you are concerned for safety and they're not reaching out and you can't get a hold of them, you could always call the psychiatric emergency response team, the PERT team, through police department, and they could go check in. Otherwise, there's not a ton that you can do. Um, just know that you are there and you've done what you can, and do what you can to take care of yourself.
Thank you. Those are all really great tips. So for our last question, someone wanted to know how they can deal with friends who have distanced themselves or unfriended them after a manic episode. And they shared that a lot of their friends have ended up distancing themselves after some behavior that they displayed during a manic episode that they really didn't mean to happen.
Okay. It's a hard one. Yes. So with this, I'm assuming the question is from the perspective of the person who had the manic episode, but your friends, your support system may have absolutely no idea of what you've just gone through. And so they may be really hurt and angry. And it doesn't mean that you've done anything wrong necessarily, but it can be helpful to even try to reach out to them so you guys can talk about it and you can explain. But keeping in mind that from their perspective, they might be feeling hurt and angry and maybe even scared. Is this going to happen again? What does this mean? And so um, this is pretty, I think this is a pretty common issue that people come across, especially with manic episodes. And it's really unfortunate. And I think as a society, we are getting better at awareness and understanding. But at least if you have reached out and you've um, attempted to build the bridge and repair the relationship, that's what you've done, what you can do, right? The other thing with those episodes, you didn't mean to. It wasn't your fault, right? Having this diagnosis is never anyone's fault. The hard part is it is your responsibility, right? Regardless of if you had control of your behavior in that moment or not. And so if you're willing and able to take some responsibility, not blame, but responsibility of, okay, this is what happened, right? That can actually go a really long way in your relationships when there's been some sort of damage there. So maybe even not apologizing for anything that you did on purpose, but maybe acknowledging where they're coming from can be really helpful. But that's a tough one. It's a tough one.
Okay, thank you. So that looks like all the time we have for questions today, but thank you so much for answering all of those that we got to. And I'd just like to remind everyone that a recording of this presentation will be available on our website and on our YouTube channel by tomorrow. So if you'd like to reference it at all, you can feel free to check it out there. But thank you for everyone who joined us. I hope you enjoyed our webinar today. And of course, a big thank you to Michelle for sharing your knowledge with us. We really appreciate it.
Absolutely. Thank you so much for having me.